When I figured this out on my own, when I was not sleeping because I was worried my mom was dying before my eyes and nobody was knew what to do to save her, I looked up online and I had done so many searches every night. And finally I said, if it's this drug, I'm just going to say, can capecitabine kill you? And I read the symptoms of DPD deficiency and my heart stopped. And I texted my dad and I sent him this article and I said, this is what's happening to mom. I know it. Just over 24 hours after I discovered that this is what I thought was happening, and brought it to the attention of her provider, she died. I mean, we just needed to know earlier. If only she was tested, and that's all I can ever really get back to. If only she was tested.
Every year, nearly 2 million Americans are diagnosed with cancer, and almost 200,000 patients will begin fluoropyrimidine treatment. But some patients are not dying from cancer, they're dying from the very drugs meant to treat it. The culprit? A change in one's genetic makeup that causes DPD deficiency, making standard doses of fluoropyrimidine medications potentially toxic. It's invisible, it's rarely tested for, and it can be deadly. An estimated 1 in 20 people in the United States carry a genetic change in a gene called DPYD, which causes a reduction in the amount of enzyme that is needed to process fluoropyrimidine cancer treatments. People with DPD deficiency are not able to properly break down common cancer treatments like 5-fluorouracil or 5-FU and capecitabine. This drastically increases their chances of having fluoropyrimidine toxicity, which may be fatal. These medications are standard treatments for several major cancers, including colorectal, anal, and other gastrointestinal cancers, as well as breast, pancreatic, and head and neck cancers. Each year, roughly 1,000 cancer patients with DPD deficiency in the US die from severe reactions tied to their cancer treatment. Yet, even though there are tests available to see if you're at an increased risk for DPD deficiency, most patients have never heard of DPD deficiency. Most patients won't be tested, and many won't even have a conversation about DPD deficiency, leading to fluoropyrimidine toxicity with their doctor. My name is Heather, and I'm a genetic counselor. I help people understand how genetic changes can impact their health, like how a change in the DPYD gene can increase your risk for having fluoropyrimidine toxicity. I also discuss with patients genetic testing options so they can better understand their risks. In this film, I sit down with 8 individuals from across North America who've lost a parent, a sibling, or a spouse to fluoropyrimidine toxicity caused by DPD deficiency. They came forward to share their story in the hopes that no one else will have to suffer the same loss. Together, we'll discuss the warning signs you need to look out for and what you can do to ensure that you know all of your risks.
My name is Jeff Plouse. My mother, Ann Plouse, passed away on November 30th, 2024. She had stage 1 anal cancer. She was given capecitabine as part of her treatment, and she was not given a screening test that likely would have saved her life.
My name is Karen Merritt, and this topic of DPD deficiency and testing is important to me because my mom died without a test. She had a colonoscopy, and which was routine, and found her colon cancer. Then they staged it and prescribed 5-FU infusion.
My name is Lindsay Murray. I lost my mother in 2021 after a fatal reaction to a chemotherapy drug, capecitabine. She was diagnosed with invasive ductal carcinoma.
My name is Dr. Vimal Scott Kapoor. My elder brother, aged 58, Dr. Anil Kapoor, died as a result of a missed DPYD deficiency. After being diagnosed with colon cancer, the medication prescribed was Folfox. And a Folfox is a combination of 3 drugs. It includes 5-FU, which is what's most important.
My name is Sean Grace. My mother, Susan, died in 2021. She had bile duct cancer and was treated with capecitabine. And it was a disaster, and I believe directly contributed to an early death.
My name is Karen Molesky. I lost my husband of 33 years, Larry Molesky, to the result of an unknown DPD deficiency. Larry took oral capecitabine.
My name's Tony Harwood. I'm interested in the topic because it was the cause of my wife's death back in 2018. She had colon cancer, and she had a drug called 5-FU.
My name is Katie Roby. My mom, Maura, died from a capecitabine overdose. It was determined that she had breast cancer, but it was specifically called invasive lobular carcinoma. And she was prescribed this chemotherapy at the full dose without us or her being informed or tested for a DPD deficiency.
The manner in which someone dies from being DPD deficient, it's basically you're getting an overdose of a drug. Basically, you're burning alive from your mouth through your anus. And that's with 5-FU. If you have capecitabine, your skin is like, you look like a burn victim.
It took a long time for Larry to decide to accept the adjuvant chemotherapy. He was very concerned about the side effects, that we were counseled about. But at the end of the day, he said to me he didn't want me to be a widow in 5 years.
My mom's initial oncologist called it the Cadillac of chemos. And they, they warned us, there would be nausea and vomiting, but it came through a special pharmacy in the mail and she could do it at home and kind of go about her daily life. It seemed like a blessing.
The doctor said, well, you do have cancer, but the good news is it's going to be a very simple treatment. We're going to give you 30 days of the capecitabine. And my mom expressed a lot of fear around it, of course, because it's cancer. She was scared, but confident that in 30 days she'd be right as rain. And my mom died from something that was very preventable.
The first signs of fluoropyrimidine toxicity can look like regular side effects, but be more severe. Can you tell me about the side effects that your loved one experienced?
They looked at his records and they said, we have had many people like you who we've cured. He was given the 5-FU infusion on a Monday. It continued at home for 2 more days until Wednesday. He returned the home infusion. Thursday, he was generally fine. And Friday afternoon, he started to get very sick with vomiting, diarrhea, severe mucositis. He started to get even sicker on Saturday. And then on Sunday, we took him to the emergency room, my emergency room. In retrospect, it was clearly abnormal how sick he got. And he couldn't eat or drink. He could have difficulty walking. His whole skin was discolored. We've spoken to some oncologists, senior ones, who say, that sick, that quick, that's definitely DPYD deficiency.
The first side effect that was really severe was her mucositis. She was having a really, really difficult time eating or drinking or swallowing. She had an incredible amount of weight loss in the first 2 weeks. She lost 18 pounds. She had severe diarrhea. We then learned that she was severely neutropenic. The list goes on and on and on. She had a hand and foot desquamation, so her skin was really just peeling off her body. And initially, they told us these were normal side effects of the medication. And it just kept progressing until she was hospitalized.
She had a reaction that became terrible within maybe 48 to 96 hours. Her lips broke out, her mouth broke out. She had terrible diarrhea. She almost immediately lost weight, like in days. She was very sick.
It's a really scary time for people to know that you have cancer. I wish that we'd done more research, but we trusted that it was such a spot of cancer that it would be so easy, and that what's the worst that could happen? When the chances of survival are so high, you don't think that about the worst case scenario. And nobody made it seem like this was scary, or that there was even a possibility of dying from the medication.
The most troubling part of this gap in care is that a test does exist. In fact, you can talk to your doctor about a simple blood test that will examine the DPYD gene. The process is relatively easy and very fast. Patients can actually get results back in just a few weeks and some in 5 to 7 days. Additionally, many insurance providers do cover the cost of testing.
I continue to share my story in hopes that others hear it before themselves or their loved one get treated with 5-FU or capecitabine to hopefully save them from the same tragic outcome as my mother and others. It's something that you watch your loved ones go through that you will never get over because it is inhumane watching your loved one burn from the inside out.
The fact that there are deaths still happening in 2025 is just, it's horrific. You wouldn't knowingly give people a drug that's going to hurt them, but that's basically what's happening. That's somebody's mother, brother, husband, son. That is why it's important to us that we want to raise awareness, because we don't want anybody else to have a loved one suffer and die like our loved ones did.
What would you say to other individuals or families who are considering taking capecitabine, 5-FU, or another fluoropyrimidine medication or regimen?
Test, test, test. You need to make sure that you are getting tested before you get this drug. You need to advocate for yourself and your loved one to make sure that you are fully aware of the drug that you are about to take and what it could possibly do to you.
I think it's really important for other families to talk with their oncologist and ask about DPD testing. And not only ask about DPD, I would recommend that every family get tested for DPD deficiency. I'll never get over the loss of my husband. I recognize that cancer and cancer treatment doesn't come without a risk. But there really is no reason with a test in place that this pre-testing shouldn't occur to be able to prevent unnecessary illness and death. No risk is too small.
I would just say, please, and I don't know other drugs, but if you're getting capecitabine or 5-FU or fluoropyrimidines of any kind, please request to get tested for a DPD deficiency, even if it's not offered. There is testing. You should get it. You can get it. Ask to get informed and to get educated about what treatments you're taking and what the side effects and risks are, because you deserve to know that. And nobody wants to lose a loved one when they don't have to.
These lives were not just lost to cancer. They were lost to a lack of awareness and a lack of testing. You have a right to know your risks. You have the right to ask for testing. If you or someone you love is considering taking capecitabine, 5-FU, Folfox, Folfiri, FOLFIRINOX, Capox, or another fluoropyrimidine chemotherapy medication or regimen, please talk to your doctor. Talk to your pharmacist. Ask about DPD deficiency and testing. This conversation could save a life. During the making of this film, the National Comprehensive Cancer Network, or NCCN, updated its guidelines on colon, rectal, and anal cancer to recommend the providers discuss DPD deficiency with patients and consider testing before prescribing fluoropyrimidine chemotherapy. Additionally, the U.S. Food and Drug Administration, or FDA, has acknowledged the serious and sometimes fatal risks these medications pose to individuals with DPD deficiency. In fact, the labels of capecitabine and 5-FU now encourage patients to discuss and consider testing. Even with clear warnings on the drug labels and an update to our guidelines, progress takes time. DPYD pretreatment testing is still not the standard of care or standard practice in most hospitals across America. So in order to ensure that you know all of your options regarding pretreatment testing and all of the risks, it's best that you talk to your oncologist, your medical team, and your pharmacist about DPD deficiency and figure out with them what option will be best for you. Every person that you've seen is a member of the Advocates for Universal DPD/DPYD testing. Their goal is to ensure that everyone gets tested for DPD deficiency before beginning fluoropyrimidine chemotherapy treatment. If you're looking for more information or support, please visit the Advocates for Universal DPD/DPYD testing at test4dpd.org.